Good afternoon, everyone. I want to welcome you to a quick review of our roadmap to our new data meeting process for 2019. This information was shared with the care managers at their January 4th meeting, and we have conducted 2 meetings so far in the month of January and wanted to just bring some things back together for you this afternoon as a refresher and as a roadmap for your next steps. So we're going to travel this road and just start down our way. I know when I travel and I set my GPS, it always wants to know where I'm at now and where am I going, and then it maps the fastest way for me to get there. We're going to try to use that model and that analogy of how to conduct our data meetings. First of all, where am I? How do I know where I'm at so I can know where I need to go? So let's just take a quick minute or two and take a look at where we have been. Here's some data that we report on an annual basis at the providers meetings for 2015, 2016, and 2017 on some key metrics we look at. And as you can see, we have seen improvement in all 4 of these key metrics over the past 3 years and in 2018 as well. So we just want to acknowledge that everybody's been working hard and that we have made some really good strides. These are some of the metrics we're looking at for 2019 as recommendations for your clinic to be able to select for study. We have some effective clinical care metrics. These are pretty standard and aren't anything really new. We have a couple of immunization standards that we'll come to later. The goal of your data meeting in this first quarter is to pick a metric that you want to improve on, specific to your clinic, and then conduct a PDSA cycle for improvement. We sort of practiced that at the end of 2018, so none of this should be new information, but certainly a refresher. Here are a listing of the clinics that have reported which metric they plan to address during the first quarter, and you can see where the individual clinics started with their baseline number at the beginning of this quarter. And as you can see, we have some clinics that are meeting the metric and exceeding the metric in some ways, and there are others that are working toward that goal. You can tell from this chart that a number of clinics have elected to focus on A1C control. There's a couple on breast cancer screening. There's a few more on blood pressure control, and again, some additional clinics on colon cancer screening. There will be some cost metrics to consider during the second quarter of 2019 as we gear up for another round of improvement, and our target cost metrics will be readmissions, ED utilization, and ambulatory care-sensitive conditions. So let's move on down this listing. So where am I? How do we know where I'm at right now today? You have several tools that you can use. There are some provider scorecards that will be shared with you on Wednesday morning, and you can share with your team your individual provider scorecards and key metrics. Who are the providers and things to consider? Who are the providers who are meeting or exceeding the goals? What are the best practices in your office for sharing? We also have clinic activity reports. This is a comparison of clinics in various metrics. How does your individual clinic compare with other clinics' performance? What can you learn from them? In our Medicare feedback reports during the second quarter of 2019, we will be sharing with you cost metrics. Are your cost trends metrics trending up or down? Finally, the EPIC dashboards, one particular called the Quality Measure Dashboard, reports your clinic's current performance in key metrics. So we want to be sure to know how to access that data and how to use it. You've seen this before. You've seen it last week. It's just a sampling of how we compare metrics across Utica Park Clinic for easy display. At the end of this presentation, I'd like for the team to spend about 3.5 minutes watching this video from the Healthcare Finance Management Association. It's on metrics that healthcare organizations should track when engaging in population health management. Some of this is more broad, but I think you'll find it interesting on how this is a process that everyone is looking at and will probably be doing for the next several years. Let's talk about that roadmap. We know where we're at. Now we want to know and try to define where we want to go. During your team meetings the last 2 weeks, you have picked a topic that you wanted to improve on. We looked at that on the earlier chart. Now you want your team to set your goal. You know where your baseline's at. And your team today needs to set a goal of where you want to be by the end of the first quarter. Let's talk about an approach using SMART goals and spend a little time with that concept. You probably have seen this acronym before. SMART stands for specific, measurable, attainable or achievable, relevant, and timely. That makes sense, right? So we want to define under specific, we want to define the goal as much as possible. We want to use clear language so everyone understands what we're trying to do. We want to know who, we want to know what, we want to know where, we want to know why. Those sound like familiar questions, right? And what constraints or barriers do we have to meeting the requirements and the goals we want to achieve? The next thing is it measurable? Can we track our progress? Can we measure the outcome? And in the metrics that we've given you to start off with, the answer is yes. How much, how many, how will I know when my goal is accomplished? You're going to set that goal today. How will I know that I'm there? So take a look at your baseline data for that metric and then predict where you think you can be by the end of March of this year. We want to be able to make that goal attainable. Is the goal reasonable? Can you get there? Don't make your goals so far out of reach or below standard. Is the goal relevant? Is it worthwhile and will it meet your needs? One of the things to remember is that these are goals not only while we are using in the clinic, they really are going to benefit the patient and their overall health over time. Is your goal consistent with other goals that you have in place, and how do they fit your long-term plans for your clinic? And then to make sure your goal is timely. We've set a time limit for this first one, for the first quarter. You may elect to continue to monitor this goal or work on this goal over your second quarter as well, but we're going to start with this first quarter. And within your clinic and within your care team and all of your staff, you want to create a sense of urgency that is going to help drive your improvement in this goal. Oh, went too far down. Go back up just a little bit, okay? So now the next question is, how do I get there? What are the steps that we have to do to get us moving toward that goal? One of the things is to know your resources and what activities you need to perform to get there. Once your goals are set, put your plan into action. Remember, you have a PDSA tool that can step you through that process. It is located on the UPC CPC Plus Connect site. Share best practices. Most of our clinics are located pretty close to each other, and we have established relationships within our care managers and within our office managers. Share with each other what you're doing. If you have questions and you don't understand something, ask. During this past week, I heard this quote, insight without action is useless. So let's put some of our insight that we know about our metrics into action, and let's move those goals forward. This is a PDSA template. I'm actually going to jump out of PowerPoint for just a minute and look at this PDSA document. I think this will give us a better view. Again, this is located on the UPC CPC Plus Connect site. You're going to fill this out today or at the end of the meeting, you're going to list your project name, which metric did you want. You're going to list the names of your clinic lead and your team members here, and then you're going to specify your goal. A recommendation, if you are not already at that metric, is to meet the 4-star measure in this area. So I'm just going to go fix this real quick. Okay, 4-star metric, meet the SMART goals. As a resource for setting goals, use that SMART guide to help you set those goals. You're going to use your data meeting scheduled times, and you might want to have a subgroup or ad hoc if need be to work on some other things. The recommendation again is to consider using your 4-star metric as your first goal. If you're already past that, look at the 5-star metric as a target. Some things to consider for this goal, some actions, planning. Use your standing orders in pre-visit planning and at the time of the visit to order A1C tests. That's really easy. Your care managers may be looking ahead in the pre-visit planning process. Your medical assistants at the time of visit certainly can complete that order if need be. Your standing orders can be found on the Workplace Connect site. Track your weekly progress on the white tracking boards that were distributed last year. Every clinic has at least one or more. Put that whiteboard up in a visible place so everybody can see it. Make an announcement when you update it so everybody knows you're making progress. Discuss again who has the best practice within your groups and what do they do. Find out what they do and share it with others. Now we've done the planning, let's do some doing. Put your plan into action. Use the Epic Quality Management dashboards to find your patients who need A1C testing. Reach out to those patients and have them come in for a lab draw. Just get the test done. Use the Epic Quality Management dashboard now to find those patients whose A1C is greater than 9. Remember, there's 2 components in this measure. One of them is that the A1C is greater than 9. The other is that it's missing, hasn't been done in a year. If the patient has not had a provider visit in the last 3 months and that A1C is greater than 9, schedule them for a visit so we can get them back on track. Do a medication review. Consider using the ADA algorithm for medication management. If you need a copy of that again, please let me know. Refer the patient whose A1Cs are greater than 9 for a diabetes education class. This is an ongoing process and ongoing education. Next, we're going to get into the study. So measure your data for at least a month. We're going to go for really the whole first quarter, but let that run your reports once a week. Report it, measure it for a month, and then look to see at your data meeting around the 2nd week of February, are you making the right progress? If not, talk about how you can make some adjustments and then do it. Report the clinic process. Update your tracking graph each time, and then celebrate the wins. At the end of the first quarter, we're going to share everyone's progress at a group data meeting. Let's jump back over here into our PowerPoint presentation. Now we know where we want to go. We've set our target. How will we know when we get there? How many of you have been on a long road trip and everyone asks, are we there yet? That's going to be a goal that you're going to want to ask almost every time. Are we there yet? How are we doing? How far away are we? What do we need to do to reach that goal? Finally, celebrate, innovate, do some things differently, track your performance, and then celebrate your goals. If one particular physician whose performance hasn't been as good and his care team does a great job, celebrate that. Make a big deal out of it. A couple of housekeeping rules here. You want to be sure to upload your data, meeting, agenda, and minutes to your individual clinic's CPC Connect site. You want to document your PDSA and keep that uploaded on the SharePoint site as well. And remember, just to restate it, our goal for this 2019 year is for each clinic to drive their data meeting based on goals. We'll hold your hand for a quarter or so, and then the goal is that you will be able to take that PDSA cycle, your metrics, the tools that you have, and be able to target your areas of performance. And finally, the last question is, if you have questions, ask. We're always available to provide additional instructions on data or where to find the data and what metrics are included. So thank you for joining today. We're going to stop this presentation, and one of the things I put in the email to the care managers is have fun with this. Make this count for good things.